Good evening, everyone. Uh, Today I'll be speaking on the topic utility of nuclear medicine in emergency radiology. The main idea to show this case is nuclear medicine scan is underutilized in the emergency setting, and it's also not given due importance during radiology training program. So I'll be illustrating a few cases in nuclear medicine, that is particularly VQ scans, HIDA scans, GI bleed, and brain nuclear medicine scan. So let's start with the cases. This patient came with history of shortness of breath since 2 months, hypertension, renal insufficiency, elevated BUN and creatinine. The main indication for nuclear medicine scan, that is VQ scan, in this patient was elevated BUN and creatinine. This is the chest radiograph of the same patient, ventilation images and perfusion images. Chest radiograph doesn't demonstrate any abnormality, and ventilation images make out that there is delayed washout, tracer washout at the lung basis. But however, there is no mismatched segmental perfusion defects on the perfusion scan. But there is some heterogeneous tracer uptake. So considering the heterogeneous delayed tracer washout and heterogeneous uptake, tracer uptake, the study is consistent with low probability for pulmonary embolism by modified PIOPID criteria. The second patient who came with mid-sternal chest pain since 3 weeks, shortness of breath. The main important indication in this patient is a 11 weeks pregnant. So only perfusion images were obtained, and these are the perfusion images of the left lung, left posterior, right posterior oblique. Sorry, this is right posterior oblique, right lateral, and left anterolateral, anterior oblique, and these are the anterior, left posterior oblique, and left lateral and right anterior oblique images. So these perfusion images are completely normal. This is particularly a normal perfusion study. So this rules out chances of pulmonary thromboembolism in this pregnant patient. This particular slide demonstrates the various segments, pictorial or diagrammatic representation of these segments of the lung and their corresponding views. These are of the right lung and these are of the left lung. So each lobe segments are depicted in different colors. Next patient, shortness of breath since 2 to 3 weeks. This is just radiograph of the patient, quite normal, no abnormality. And these are the ventilation images. Ventilation images, they demonstrate heterogeneous distribution of the traces. And these are the perfusion images. You can clearly make out that there are large mismatched perfusion defects in both upper lobes, which we can see in all the images. So by modified PIOPID criteria, the study is consistent with high probability for pulmonary thromboembolism. And this needs to be confirmed with either a CT angiogram, whether there is really PE or pulmonary thromboembolism or not. The next patient who came with history of sharp chest pain, shortness of breath. The chest radiograph demonstrates this cardiomegaly and small to moderate left pleural effusion, and there is also some opacity in the left lower lung. These are the perfusion images and corresponding ventilation images. So the perfusion and ventilation images are alternating. They are not separately given here. So here there is a triple match defect. That is, there is a matched defect in the left lower lung both on the ventilation and perfusion images with a corresponding abnormality on the chest radiograph. So this is triple match, and rest of the left lung demonstrates decreased perfusion and ventilation. However, the right lung appears there is no perfusion defect on in the right lung. So this triple match defect in the left lower lung by modified Pyopid criteria is consistent with intermediate probability for pulmonary thromboembolism. Next, coming to the HIDA scans. Majority of our cases were acute cholecystitis and normal studies. And only few cases, we had only 2 cases of biliary leak and 1 case of gallbladder dyskinesia. So this is a patient, 68-year-old female patient who came with acute abdominal pain post-surgery. These are the HIDA scans performed after the surgery to rule out biliary leak. This is immediately after the injection. This is 5 minutes, 10, 15, 20 and 25 minutes. However, this study was stopped or terminated at 30 minutes because the patient was not able to tolerate the pain. As we can see here, there is accumulation of the tracer in the gallbladder fossa starting at 10 minutes, and it's progressively increasing up to 25 minutes. And this study was consistent with biliary leak, positive for biliary leak. Next patient came with abdominal pain, a 63-year-old female patient. As we can see here, these HIDA scan images demonstrate homogeneous tracer uptake in the liver. There is also excretion of the contrast into the opacification of the biliary ducts and small bowel, but we do not see any opacified gallbladder in any of the images. Colitech was administered and series of images at an interval of 10 minutes were obtained. So again the gallbladder is not visualized. So the finding we saw is non-visualization of the gallbladder even on delayed images after administration of Colitech. So the corresponding ultrasound images demonstrate multiple stones in the gallbladder of the same patient, multiple stones in the gallbladder, and also the most important finding is there are stones in the cystic duct. So this study is consistent with acute cholecystitis secondary to cystic duct obstruction. So the main finding in HIDA scan is non-visualization of the gallbladder. Next, coming to the GI bleed. Majority of the cases, they turned out to be normal study, and the remaining turned out to be positive for GI bleed. A 63-year-old female patient came with a history of anemia and abdominal pain. So these are the dynamic images which are obtained after the injection. We can see that there is abnormal blood pool activity over the splenic flexure. You can see in all the dynamic images it is seen more prominent as we go to the near delayed images. The same finding is confirmed here on the static images, delayed images, and this increased or abnormal blood pool activity is seen progressing distally to the descending and sigmoid colon. So this study is positive for GI bleed, and the source of the bleed is splenic flexure of colon. And this was a very interesting case. This is a young patient, 24-year-old female patient who came with right lower quadrant pain. These are the CT images, contrast images of the abdomen, demonstrate there is inflamed diverticulum along the anti-mesenteric border of the distal ileum. You can very well appreciate in this image that the inflamed diverticulum, and we gave a diagnosis of inflamed Meckel's diverticulum, and recommended further confirmation with the nuclear medicine scan. We can see this same coronal image and sagittal image of the inflamed diverticulum. As we can see here, after injection of the technetium, there is increased activity in the region of the inflamed Meckel's diverticulum. So this confirms that it confirms the diagnosis what we made on CT as Meckel's diverticulum. The images are very small because multiple images were there, but these two images, it's very well clear that the tracer uptake in the inflamed Meckel's diverticulum. This is a brain scan not regularly done. The history in this patient was patient found down at home, minimally responsive and altered mental status. Contrast was injected, when the tracer was injected through the right central line, and these are the anterior images taken at interval of 4 seconds, starting from 0 to 92 seconds. Next set of posterior images which are taken again at interval of 4 seconds, and there are delayed images which are taken like lateral, anterior, all these are delayed images, that is 20 minutes delay images. So none of the images demonstrate activity within the brain. So either in the anterior images or the posterior images, there is no brain activity. And even on the delayed images which are taken at 20 minutes, there is no cerebral activity. So the study is consistent with absent cerebral perfusion. So brain dead patient. So to confirm the brain dead in medical legal cases, helpful. So to summarize, VQ scan is specifically useful in pregnancy, contrast allergy, and renal failure patients. And HIDA scan is useful in evaluation of acute cholecystitis when ultrasound or CT scan is equivocal. Biliary leaks, especially in the postoperative period. And GI bleed is very useful in determining the exact site of bleed, especially when the bleed is intermittent, and mainly the lower GI bleed. And brain scintigraphy is mainly performed to evaluate the cerebral perfusion in brain death patient and CSF shunt patency. Thank you.